So the indications for a full denture. One, the patient is edentulous. So a patient that is edentulous is a patient who does not have any teeth whatsoever. Okay, so that would be referred to as edentulous. Guys, please make sure that you guys know how to spell terminology, understand what the terminology means, so that studying and everything is just easier. They're very important. So one, the patient is edentulous. So that's when we will make a full denture, either in the maxilla, in the mandible, or in both. Ne? And then from there, the remaining teeth cannot be saved. So if the teeth, like I'm saying, are like very mobile, for example, class 3 mobility, like they're flying out of the patient's mouth, or they have very gross caries, or they're predominantly compromised, or they have lots of abscesses. Those are teeth that cannot be saved. They must be extracted, and the patient must place a full denture. So that would be an example. And then the remaining teeth cannot support a removable partial denture, and no acceptable alternatives are available. So the remaining teeth cannot support a denture. So that would be, like I'm saying, teeth that are predominantly involved. They have undergone an infectious process. They are very carious. They are very mobile. Those are teeth that cannot support a removable partial denture. And then no other acceptable alternatives is, for example, patients who do not have the financial resource to either make a bridge or construct implants or even overdentures, like something that is fixed and there's no other solution, then you would go for a removable full denture. And then as well, for patients that refuse alternative treatment recommendations, like I'm saying, normally it's usually because of finances, but others are not willing to stick with the terms and conditions of like fixed dentures, in terms of like their expenses, having to come to the practice every now and again. They just feel like it's too much work. Then a removable full denture would be for them. So then the contraindications to a full denture, acceptable alternative is available if the patient has the financial means, or there are less more conservative procedures, for example, such as bridges and restoring teeth and trying to predominantly save the arcs. Then such things, there would not be a reason for you to have a full denture. Like I know with patients here, for example, because it's a very colored community, they are very prone to extracting teeth. So you would rather advise somebody to try and save what they already have, as opposed to just being quick to extract teeth and place a full denture, for example. And then from there, physical or mental illnesses affecting the patient's ability to cooperate during the fabrication of the denture and to accept or wear the denture. So a patient who's not willing to, who's poorly motivated, just has no sense of anything, has a terrible attitude, don't place a denture, because they're going to constantly be coming back to the practice, constantly complaining, annoying the dentist as well as the dental assistant. So if someone has a poor attitude that you can't help try and improve with your enthusiasm and good service, leave them alone. And then, like we're saying, with illnesses and physical illnesses, so like we were talking about neuromuscular factors, so if the patient has muscle atrophy or flat muscles, or with mental illnesses where they just can't seem to cooperate or cannot comprehend what you are asking of them, then you would not go for a full denture. And then patients who are hypersensitive to denture materials. So normally these are patients who are allergic to resins. So it's very important when you have a denture patient in chair, ask them, are they allergic to any resins or acrylic, or have they ever reacted to any material when they used to go to dentists like months or years before or previously. So if they say yes, try and figure out what the patient thinks they reacted to, and then try and avoid such materials. And then in other practices where there are financial resources, they have like allergen tests or hypersensitivity tests. So you would help your dentist perform that test so that we can ascertain what the patient is actually allergic to before we actually try and fabricate a pair of full dentures. And then, like we mentioned before, a patient who's not interested in replacing their missing teeth. Sometimes there are problems you try and identify and tell the patient the importance of replacing your teeth. So every time there's a patient who has lost a tooth, except for the third molars, everything before anterior to the third molars. Try and convince a patient or explain to a patient the importance of replacing what has been lost. Like, hey, if you don't replace your teeth, your teeth at the back or in the front, they're gonna start moving, or at the top or the bottom. Like, teeth don't stay in one place for a long time because of the muscles of the face. So if you do not replace it, you're going to lose that space, and then we won't be able to do anything about it. So if still after your little explanation the patient is still not cooperating or is not interested, then we will just leave them alone. So components of a full denture. Full dentures have basically two main components, being the denture base and the artificial teeth. But with the base, there's subcomponents, if I can put it that way, né? So the base, like I mentioned before, is designed to fit over the residual alveolar ridge. Remember that, residual alveolar ridge and supporting gingival area. So the underlying bone, so the base goes onto your underlying bone as well as the gingiva that surrounds our underlying bone. So that's basically where the denture base is going to fit onto in our mouths. And then from there we have the flange. The flange is the part of the base that extends over the attached mucosa from the gingival margin of the teeth to the border of the denture. So basically, with that being said, the flange is the vertical extension of the denture, né? So we try and keep it to the attached gingiva, and it's the part that basically gets into your vestibule, but not so much past the alveolar mucosa, otherwise it will fall off. I don't know if you guys know these terms or not, if you've covered this anatomy. So we try and keep it to around the area of the mucogingival junction. So you know how we go from our light pink in our mouths to that dark pinkish area? Yes, so we try and keep it along that border or slightly above it. So hence they're saying from the attached mucosa, so basically from your base, yes, the cervical margin of your teeth to the border of the denture. So that vertical extension is known as a flange. Then from there, ladies and gentlemen, we have our post-dam. So our post-dam provides retention of a maxillary denture, and it depends on the suction seal. So I would say that the post-dam is like an imaginary anatomical area that is on the posterior aspect of your palate. So it goes from one maxillary tuberosity to the other maxillary tuberosity. So that area is known as a post-dam. It's very significant because if you go past that area in the palate, then your denture is not going to have retention, therefore it will be loose and constantly fall out of the patient's mouth. So it's very important that we keep in line or keep our denture from one maxillary tuberosity to the other. So that area, especially in between, is known as your post-dam. So it provides our posterior, our palatal seal for our denture, so that food and liquids do not get into the space between our denture base and our alveolar ridge in the maxilla. And then from there, ladies and gentlemen, is our artificial teeth. So artificial teeth can either be fabricated from porcelain or acrylic. So acrylic is a nice material because it's easy to polish in chair. We don't have to take things necessarily to the lab to get adjustments done, and it's much more stronger as opposed to porcelain as a material, and actually cheaper than porcelain as a material. Whereas porcelain teeth, obviously highly aesthetic, but both of them technically are quite highly aesthetic. Porcelain teeth tend to make like this clicking sound when the patient is speaking, so that's the one disadvantage of them. They're very resistant to staining, these porcelain teeth. So especially, for example, with your smokers, you're more likely to select porcelain artificial teeth as opposed to the acrylic ones. The other problem with porcelain teeth is that they require a mechanical action to actually keep them in place relative to the denture base. And then from there, if you had to make adjustments, you'd have to then go to the lab, or the denture needs to be sent to the lab to make adjustments in terms of polishing porcelain teeth, whereas the acrylic ones, you can get away with making adjustments in the chair at the dental practice. So ladies and gentlemen, I'm going to discuss now the steps that we'll have to undertake when we're actually making dentures in our practice. So say now here comes Mr. Martin, for example, he walks into our practice now, he would like some dentures. So the first thing we do, like your slides say, records are very, very important. So the first thing you do, obviously, as a dental assistant would be to take an updated health and dental history. So with health, we want to know all of the patient's medical conditions, what medications they're taking, have they ever had any previous medical conditions that we should be aware of, because I told you those are going to influence the type of prosthesis that we will be fabricating for our patient. Then from there, with our dental history, then we'll just talk to the patient what previous treatments they have had, so that we just see what we are working with going forward. And then from there, you're going to get materials ready for our preliminary impressions. So with our preliminary impressions, if you remember last week's presentation, it would be our spatula. You'll have to get our spatula ready. We will be having to get our flexible bowl ready. We will be having to get our measuring cylinder ready, as well as our perforated plastic trays ready for both the maxilla as well as the mandible. So those are the materials that you as the dental assistant would then have to get ready. And then from there, if the patient has radiographs or we need to take radiographs, then this is what's going to happen at this appointment. So we're either going to take periapicals or bite wings or even a pan. But normally a pan for edentulous patients is not really indicated, but actually radiographs for our edentulous patients are not really indicated. It's more important for our partially edentulous patients that we will be having to take radiographs. Then from there, photographs. So photographs are also important. We will be taking a frontal view of the patient. We'll be taking a profile view of the patient. You can also even take lateral views of the patient, so that you guys can compare before and after, as well as having records for the patient, highly detailed records for the patient. I think the one thing I'd also like to emphasize about this appointment is actually talking to the patient. Like, especially if they're like first-time denture wearers, or they don't know what they want to have in their mouths. Like we want to discuss finances. We want to put the patient first. We want to talk, how did you lose your teeth? How do you feel about the fact that you've lost your teeth? What don't you like about the teeth that you already have? What would you want us to improve with this set that we are going to make for you? Like, put the patient first. Like, I think we spend so much time with the science instead of actually focusing on the patient in chair. So those are some of the questions that you should be, or we expect you to be discussing with the patient, either with the dentist or you yourself as an individual. But just get like where the patient's head space is at in this particular juncture regarding their teeth. Okay, so that's also like a good opportunity to suss the patient out before we actually decide on which type of prosthesis we're going to fabricate. So please, let's talk to our patients, especially during the time where we are updating our health and dental histories. Please, let's just talk to our patients so that they feel seen and heard and respected. In that way, they will forever be loyal customers or patients to the practice. Then, okay, so once we're done talking to the patient, done counseling the patient, we then have to explain to the patient what's going to happen. So this is the part where you're going to be telling your patient that these are the treatment options. For example, you need a removable, you have some teeth left, so we've decided to go with the removable prosthesis. Now, that's when you will then explain to the patient, or a full denture even, that's when we explain to the patient that it may require multiple appointments. And you're going to also explain to the patient that for today we are going to select, for example, the color of your teeth in natural light. We're going to select the shade for your new teeth. We're going to take measurements of your mouth. And yeah, those are some of the things you have to tell the patient before we actually start with the procedure. So in the first appointment, it's the primary impression appointment. So 2 alternate impressions are taken with denture impression trays. So you remember all the material that I told you guys to get ready? Yes, you're going to take your maxillary as well as your mandibular perforated trays. Then those are the ones that we're going to use. So we're going to, okay, they're already clean. Sometimes we can even use a tray, just spray onto the tray, and then from there we're going to mix our alginate just to help the material to stick onto the tray. Yes, and then from there we're going to take an occlusal registration, usually taken with wax. So if you remember last week, we discussed taking bite registrations with either wax or polysiloxane material. So like I said, polysiloxane material is normally more expensive, so then we normally take it with wax. So we're going to take our little wax sheet, fold it, and then make a little horse red shape. Then we're going to take that occlusal registration, and then from there the impressions are then sent to the lab for making of special trays. So you need not necessarily take the shade at this particular juncture. You may take it at the next appointment when the lab brings back your special trays. So special trays, if you guys can remember, or I don't know if you know this already, but special trays, so you remember when we take our initial impressions, we're taking them with the manufactured or prefabricated one size fits all trays. So when these alternate impressions go to the lab then makes special trays. So with the special trays are basically trays that are still going to take alternate impressions, but now they are specific to the patient that you are attending to. So special trays will not fit everyone's mouth. They are literally meant for the patient that we will be having in chair. So that's what then the lab will be doing or fabricating with the initial alternate material or the initial impressions. You're probably asking yourself, why didn't we use just the initial alternate impressions to make our denture? No, we use the special trays. We use the measurements taken in alternate using our special trays so that it fits better. So we allow for better adaptation of the patient's mouth. So we're trying to get the best possible 3D replication of the patient's mouth so that this denture can fit properly, it can seal properly, it can be stable, it can have lots of support just by taking a good impression. So that's basically why we go the extra step of taking or fabricating rather a special tray. So after taking our impressions to make special trays, we release the patient. Bye bye, Mr. Martin. Then we make an appointment for the patient to